Welcome back to the Laura Dowling Experience podcast, where each week I bring you insightful and inspiring guests that will open your mind and empower your life. Before we get into today's episode, I would love to ask you for a little favour. If you like this podcast, and I know so many of you do, you could really help me out by giving it a nice rating, sharing it with your friends, and subscribing to the podcast. It may not seem like a big deal, but actually this really helps to keep the podcast high up in the charts, and that means that I can keep bringing you brilliant guests who are insightful, inspiring, and full of wisdom that we can all learn from. Thanks a million. Now let's get to it. Glow from the inside out. With my Fabu Skin, Hair and Nails Glow, which blends 12 active ingredients including reishi mushroom, amino acids, vitamins and minerals to support collagen production and skin, hair and nail health on a cellular level. See the amazing before and after pictures of fuller, thicker hair, radiant glowing skin and longer, stronger nails on fabwellness.com. Available on fabwellness.com and in pharmacies and health food stores nationwide. Eimear, thank you for joining me.
Thank you for having me, Laura.
'Tis a cold afternoon.
It's freezing. We're both back from holidays and feeling it.
I know, but we're cozy.
Yeah.
I wanted to get you on. I've been dying to get an oral hygienist on, actually, because I feel that you're undervalued in terms of the way we look at our entire healthcare if we're looking at it holistically.
Yeah.
People's oral health is so important. There's a link between oral health and dementia and all kinds of other illnesses. So can we just start from the start? What does a hygienist do?
So a dental hygienist is your preventative practitioner, essentially. I love being a dental hygienist because we kind of occupy this little space in healthcare that's purely focused on prevention. So if used properly, we should be able to get you to avoid decay and gum health problems. However, the current system, we tend to see patients when they have problems. So we will help you and guide you through your oral health. We want to educate you. We'll clean your teeth, look after your gum care. We can do things like fissure sealants, try to help prevent decay, diet advice, smoking cessation. We're always trying to change behaviours. So we want to move you from poor health to health and then keep you there. And then work into that, the whole health system. You don't treat a mouth, you're treating a patient. Like, have you ever seen a pair of teeth walk into a surgery? No. You see a person. So you treat the whole person. So the dental hygienist is really working with you several times a year. You could have like a short burst of treatment and then you might be seen every 3, 4, 6 months after, depending on how your health is and any inflammation that we see in your mouth.
And do you know roughly how many people go to see hygienists? Like what percentage of the population go?
I actually don't.
Yeah.
I can tell you there's less than 600 dental hygienists in the country.
Okay.
For a population of, what are we?
5 million?
Yeah. So, you know, we're spread thin and far.
To me now, it strikes me, I was talking to, so Aisling is my dental hygienist.
And she's fabulous.
She is. That's how you and I got in touch. But she says she just loves cleaning teeth, like cleaning the grout out of the tiles. You know, she just loves, and
it's so satisfying.
I could think of nothing worse than to do that, but obviously it's satisfying for people that are in the game.
Yes. Yeah. It's very rewarding. And we use a system, myself and Aisling, in the practice that we're in called guided biofilm therapy. So that's really a focus on minimally invasive. So I always feel with dentistry, if something is healthy, you shouldn't be doing too much to it. You just want to maintain that position of health. So we use a system where we spray warm air and powder onto your teeth. We disclose your plaque so you can see what's there. And it's all about that journey with the patient of showing you what's in your mouth because you have control of that. The mouth is fascinating. Like, you get to see inside your body every single day. If you've got inflammation, you very quickly know about it because your gums are going to bleed. And then you can very quickly treat that a lot of the time at home and a lot of the time with your dental team.
Okay.
Fantastic.
So
I'm very excited.
I know, I can tell. I feel that people don't go to see the dental hygienist enough. Now, I know that it's generally private care as well. People have to pay for it. Unfortunately, we don't have a system set up even with a medical card and that. People may get their fillings, their extractions done, but they don't get to see
the dental hygienist.
Which is actually, it seems bizarre, because if it's preventative health, wouldn't it be wonderful if people were seeing them? They may not need the extractions then.
Yeah, it's really skewed in that, like, the WHO had set a target from 2024, I think, to 2030 to reduce the global burden of dental disease by 80%. Sure, no country is anywhere near that because the prevention isn't given the priority. So if you imagine it, I suppose, like you've got the dentist at the top, and then like the dental specialists come across from that, and then the hygienist, dental technicians who might make like your dentures and things like that, crowns, and then you've got dental nurses and oral health promoters. So if you could actually get your dental hygienist first to educate you to prevent the diseases and the problems, so anything from diet advice to smoking cessation, as I say, to look at your gums, and then you go to see the dentist for treatment where needed. That's a much better system. And it also frees up the dentist to do the more complex work that they do then. And they're not tied up constantly just doing exams, or we want to do the prevention.
And what do you see? You're a regular person like me going in to get my teeth cleaned. Generally, are we brushing properly? Are we flossing properly? Or in general, are people not doing it well?
The flossing, you've hit the nail on the head. Like I think as a population, we're just not there yet. So people will come in and they'll say, oh yeah, I brush twice a day. But then they won't brush properly because they've never been shown. So that's really important. If you don't brush your gums, you're going to miss a huge portion of where you need to clean. So if you think you've got your tooth down here and that's your gum.
So you're showing a state, you need to explain that verbally. Because people
won't see it.
People won't see it. They're more audio listeners.
Yeah. So if you think about your mouth, so you've got your tooth comes out from your gum.
Yeah.
And your gum is like that little semicircle kind of scalloped shape.
Yeah.
Bacteria love to hide in there. Okay. So it's not, we have this saying brush your teeth, but we need to brush our gums gently. You know, use a soft toothbrush or an electric toothbrush and gently clean your gums as well. Don't be going mad scrubbing because you can cause problems. Just a nice gentle massage of your gums lifts all of the bacteria away. And then, as you said, flossing, we're not great at that. That's the big area. People will be good initially when they've come to see you for maybe 6 weeks, and then they'll drop off until the next appointment. But plaque builds every 12 hours. So if you're not cleaning in between, or if you're not brushing properly, you're going to have plaque there, and it's going to irritate your gums and potentially cause gum inflammation, gum disease, dental decay.
So is plaque just a build-up of bacteria?
Yeah. So as we sit here now, we have up to 700 types of bacteria in our mouth. So that's like 2 billion bacteria. So if things are healthy, everything just gets along nicely and they're happy out. But if we allow it to build and don't mechanically, so that's your toothbrushing and your interdental brushes or your floss, get it out of there, it forms plaque. The longer the plaque is there, the bacteria gets a bit nastier, it starts to change, it starts to kind of burrow up under your gum. And again, consider under your gum, you have a tiny little layer of bone, and bacteria likes to get at that. So by constantly just disrupting that plaque, you can keep things healthy. But it's consistency.
I remember those old toothpaste ads, the Crest ones, where they show the tartar.
Oh, yeah.
Picking it off, and it is like, that is satisfying to watch. Is tartar harder plaque?
Yeah, so if you think that plaque is soft and sticky, it sticks to your teeth because your teeth don't shed. It's always able to hang on there.
Okay.
So that's why you have to get in and get rid of it. But tartar then, if you don't get rid of it, saliva in your mouth or the fluid under your gums will harden it. So it becomes a different sort of creature. It will sit on your gums or under your gum, and it'll push your gum out, which allows the active plaque bacteria to get in and out there, have a little bit of a party. The bacteria in your tartar or your calculus can be quite aggressive as well. So again, it's trying to erode your bone away from your teeth. So if that's gone, it's gone. We can't get that back. Okay. The same if we recede our gums. So it's so simple. It's one of the easiest parts of your body to keep healthy. Good brushing for 2 minutes twice a day and clean in between once to twice a day.
And you said brushing with a soft toothbrush, not one of those hard ones.
No. Again, plaque is soft and sticky. So if you go in with a hard brush, you might get rid of it, but you're not going to properly clean your gums because it hurts. Okay. It's like using a yard brush on your gums. Oh. So like a nice soft brush or extra soft. Some really nice ones out there. Plain, small little head. Sometimes, you give people a toothbrush and they're like, this looks like a kid's brush, but consider the size of your teeth.
Yeah.
It's very small. If you put a large brush in there, you're going to be scrubbing away, but not effectively because it can't reach into where it needs to maneuver. So either a small-headed electric brush or a small-headed manual soft or extra soft brush.
Well, actually, full disclosure here, now you're going to think I'm a dirty bitch, but fuck it. My hygienist told me the last time I was in that, she goes, you're not brushing the back of your teeth.
Yeah.
You're not brushing the very back ones. And I was like, well, I am. She goes, no, but like, are you actually shoving... And when I went home that day then to see, I wasn't shoving the toothbrush right back. So I just ending my teeth brushing session at about the third tooth in.
Yeah.
And as a result, then the other two weren't getting looked at because I suppose it's harder to get in there.
Yeah. So what happens is we kind of, where we see, we do really well.
Yeah.
Where we know other people are going to see, we do even better. And then we can often forget those back ones. So it's kind of the best way to get to them is do that first. I always say that's one of my big things. If someone's consistently missing an area, start there. Because you're most interested, you've got more motivation, and you'll always do these ones well at the front. But the back ones are trickier. So open wide, pop your toothbrush in, and then close, and your cheek relaxes, and you get that really, the muscle relaxes, and then you create this pouch of space where you can get your toothbrush in.
Okay, and are electric toothbrushes better than manual ones, or?
Yeah,
they are
better. Depending on the brush, but electric brushes will generally remove 7 to 10 times more plaque than a manual brush. You have different types. You have like the Oral-B, which are the oscillating, rotating, so the circular head.
Yeah.
I prefer them. And then you have the sonic brushes, which would be anything like the Philips, the Rhesus, the Spotlight brushes. And they just use like a more vibratory technology to try and disrupt the plaque as it goes along the gum. Yeah.
And then dental floss versus the interdental brushes.
Interdental brushes every time.
Okay.
Yeah, we kind of have a rule that if you can get a brush in, use the brush.
Okay.
Because it'll kind of fill your space better. And they're nice and soft and they massage your gum as well. And
explain to people what they are actually first.
Yeah, so if you imagine a bottle brush, so those little, it's a long wire with little, like a Christmas tree bristles sticking out the side, and they come in like variety of sizes. So if you have a huge space, they'll work. If you have a tiny space, you just get a smaller brush, and they go in between your two teeth and your gum and clean that area out for you. And it's technique wise, they're easy because they pop in
and pop out.
Yeah.
But you know the way with dental floss, you're supposed to stick it in and then curve it around your teeth. But I don't feel that you're doing that with an interdental. Do you get as much cleaning?
You do. So with the interdental brush, it's like a micro toothbrush. So once you get in there into that space and you've got the correct size, that's really important. If it's too small, it's pointless. But if you've got the correct size, those bristles will get in. They'll massage that gum and clean that area and disrupt your plaque. So you don't just kind of poke it in and out. You've got to bring it in, curve it to one side, in and out, and then pull it forward and do the other side.
Okay.
Yeah. So then you're really thorough clean. And always do that before you brush.
And it's about disrupting the microbiome in there, is it? Is that what that interdental is doing, just to disrupt it all, to get rid of it and kind of move it around a bit?
Yeah. So your microbiome is all the bacteria in your mouth.
Yeah.
So plaque is like what we call a biofilm. So it's like that sticky stuff that will hang onto your teeth. So if you run your tongue along your teeth and they feel a little bit furry, you've got plaque. So I have plaque. I can feel it there on my canine. I'm like, I didn't do a good job there. But the interdental brushes will get in and they will disturb that bacteria. You've got to mechanically remove it. If you think about your gut, you've billions of bacteria there as well, but your gut's constantly in motion. Your mouth isn't. So you have to clean it out yourself. You've got to mechanically remove it so that it's not building up and causing you problems. Okay.
And what age should children start using floss or interdentals?
As soon as they have two what we call opposing teeth, so tooth side by side.
Oh goodness, that young.
Yeah, and look, I'm a dental hygienist and I wasn't flossing my kids' teeth when they were 1.5, you know.
Yeah.
Science and the reality of being a parent are very different things.
Yeah.
So like before I had kids, I would have been like, don't ever give them a dodie, don't do this, you know. When you have kids, you've got to be practical. Sleep is so important.
The bribery comes in.
Anything. My youngest was given, because she had infections, a soother with sucrose on it to make her suck a soother to help her sleep. Can you imagine? I was sitting there going, oh God, no, you can't do that. You can't do that. But she wasn't sleeping because she was so upset with her, whatever illness she had at the time. But
you got to do what you got to do.
You got it, life is life.
So as soon as they can probably manage it, the interdental, because I think that children would find the interdentals easier to use than the flossing.
You've either got the little floss on the handle, you know, it's like a little harp.
Yeah,
they can be quite useful. But really, for parents to do it, it's generally better, because if you come at your kid like this, like from the front, they feel like they're under attack, and sometimes you get resistance then from kids and like, I don't want to brush my teeth. So 2 things: let them see you brush your teeth first of all. It normalizes that behaviour. Let them see you floss clean in between. It's like them swiping a phone now. If they see it, you do it, that's the normal behaviour. And then when you want to do it for them, because toddlers are fierce independent, but if you come from behind and let's sit in front of a mirror, you're brushing their teeth in the same angle that you would do yours, but they can see what's happening. And it feels more like a hug. It's more relaxed. It's easier. So that would be one tip to help your kids brush if you're having issues. And secondly, don't do it right before bed, because that's crazy hour. Like, you get nothing done in that hour except torment. So if you're trying to add something, then they know that's a trigger for bedtime. And that can sometimes start that descent into craziness before those toddlers go to bed. So if you do it once you know they're not going to have anything else to eat or drink, it could be 6 o'clock, it could be 5 o'clock. Do that. Other than water, you're fine.
Okay.
So it's kind of, it has to fit in around your lifestyle.
Yeah, of course. So tell me about what you see in the surgery yourself then. Yeah. What are the type of people that will come to you? What would you see the most of?
Gingivitis and periodontal disease.
Okay, so what are they?
Gingivitis is inflammation of your gums, mostly caused by plaque, but it can be caused by medications. You can have it in pregnancy, mostly caused by plaque, and that's reversible. That's, when you see those ads where you're spitting in blood into the sink and things like that. If your gums bleed, it's your first sign of inflammation. Gum disease or periodontitis is different. That's when you start to lose some of the support around your teeth. So the bone that I was saying about earlier, your alveolar bone, it's thin. It's a specific type of bone only to hold your teeth in place. So if you aren't looking after that, if that bone's gone, it doesn't regrow. If you lose a tooth, the bone that would have been around that tooth disappears as well. So gum disease is when you have loss of bone and support, like your connective tissue, your little ligament around your tooth. So they were the two biggest things I would see in practice.
And does gingivitis, if not treated, lead to gum disease?
Yes. So if you have chronic, so long-term gingivitis, you've got constant inflammation there. So you're constantly, that bacteria is changing, it's growing, it's getting worse, and it's going to lead then to gum disease. It won't happen overnight. Okay. But eventually you will get there.
And can you get gum disease without gingivitis?
You can. Okay. So you can be predisposed. So you can do everything well. You could have the best brushing, the best diet, the best interdental cleaning, and still be just predisposed genetically to certain types of gum disease. If you smoke but have excellent hygiene, you're going to have a higher risk of gum disease as well, because your vascular supply or your blood supply is quite poor then to the mouth. So you're a higher risk of gum disease and oral cancers. Yeah.
And are there any other diseases that would make it you more predisposed to gum disease or illnesses?
I suppose if you're generally immunocompromised, you could be at greater risk, because if you've got a constant inflammation in the body, that can work both ways. So if you have diabetes, for example, and your diabetes is poorly controlled and you have got gum disease, that's bidirectional. So if your gum disease is really poor, your diabetes can go down. Yeah. If your diabetes is really well controlled, your periodontal disease or gum disease can be better. Okay. So that's what we call bidirectional. Same with rheumatoid arthritis. Both of those are connected, that if you get your gum disease under control, your arthritis can be massively improved. There's great links. Yeah. Okay.
So tell me more about those links between diseases and gum disease. I spoke earlier at the start there about to mention that there's more and more evidence coming out. So I'd love you to expand on that for me, because I know very little about it.
Yeah. Years ago when I first qualified, we weren't sure. There was always talk that there could have been links. But now there's concrete evidence to show that patients who have gum disease and it's not controlled have a 70% increase of getting Alzheimer's.
70?
70. Like, that is massive. Jesus. Yeah, it's really scary. Why? So you have a bacteria in the mouth, and it's nasty one if you have it. It's called Porphyromonas gingivalis, so P. gingivalis.
Fucking sounds awful.
Yeah, it does. It's a nasty one. Obviously, we don't test for that in the practice. Yeah. So if somebody comes in with gum disease, you just assume that everything is there. And you just want to clear the whole tooth surface off and make that nice and healthy. So you can do the cleaning is great, because it will get rid of all of that bacteria, and then the patient with the home care. So there was a study that had over 20 years. It was a really good study. And I think they followed 20,000 people. And those patients who got their gum disease under control tended to do better. Those who had really poor gum disease and the P. gingivalis was kind of rampant, what happens is, if you look where your mouth and your brain are, like, the skull is a tiny space, it travels. But what it does is once it gets up towards the brain, it releases an enzyme, and they're called gingipains, and they are able to break down your neurons in the brain and the brain tissue. So it's really aggressive, not just in the mouth, but as it travels, it can cause all sorts of problems. If you then have Alzheimer's, you know, your oral health tends not to be so good because things aren't great. Then your cognitive decline is more rapid in those patients with gum disease who have Alzheimer's, because they're not able to take care of their mouth as well as, say, you or I would be able to. So it's really important, as long as we can, keep our mouth healthy. So
not only does gingivitis and this particular bacteria lead to a 70% increase in getting Alzheimer's, it's this vicious cycle that once you have Alzheimer's, you can get cognitively worse a lot quicker because you can't, you don't have faculties to look after your mouth.
Yeah. So if you're sitting there and you have Alzheimer's and you have really poor gum disease, and I'm sitting here and I have Alzheimer's but really good oral health, your cognitive decline will be faster than mine.
Wow. And why don't we talk about this then?
Yeah, it's because I suppose people aren't sure. People are always a bit wary, I think, with dentistry. It's kind of like they've pinholed the mouth to be the mouth. But sure, like your foot is part of your leg. You know, your hand is part of your arm. Your mouth is part of your body. And I think it's been wonderful in the last kind of 5 years, pretty much since COVID. There's been masses of research done that really are linking bacteria in your mouth to what's happening in the rest of your body. So I'd have these conversations with patients regularly, and you have to always be careful how you present something to somebody,
because what we don't want to do is scare people, and that's because when you hear 70% increase in Alzheimer's, people go, oh my god, and we don't want to do that. But it's about getting the information out there, but not being
scaremonger.
Yeah.
The reality is, like, that's what the research found, but it doesn't mean it will happen to you. It just, and not everybody with Alzheimer's has poor oral health.
Yes.
You know, so it's more challenging for those patients because it's trickier to get in there for them, because their day-to-day routines are very different. And if they've got somebody at home caring for them, they're under immense pressure already to care for a loved one, or even if you've got extra help coming in, the skills they have, they're not dental hygienists, they're not dentists, they can't get in.
But even, I think as well, it can be difficult actually to get near people when they have Alzheimer's or dementia, because they can be quite averse to you touching them.
And again, that coming at somebody from that, like if someone came at me with anything, you kind of recoil and you don't want them at you. It's very disruptive to you, it's very upsetting. So it's hard.
God. Do you see an increase in gingivitis and poor oral hygiene as people go through menopause and hormone levels decline?
Yes.
And it's not necessarily due to them being having poor hygiene, it's more due to the hormonal fluctuations. Like even it can cause dry mouth, which reduces the saliva. So explain all that, please.
That's a massive one. And it's always really important that, again, you're back to the patient, that everybody has ups and downs in life, and particularly women. Like, you've got puberty, you may have pregnancy, and then you have menopause, and hormones go crazy, and your mental state can be different when you're going through the menopause. Your motivation can be different. So that can, first of all, affect your ability to clean, because your focus is all over the place. You then can get dry mouth. You can get burning mouth syndrome as well.
It is awful for women.
Oh my God. Like,
what do you recommend for burning mouth?
Cooling gels.
Yeah.
So you've got things like Biotin, BioExtra.
Yeah.
And there's another gel, which I can't think of it right now, but you can just rub those in and they soothe the tissues. You used to be able to get Dactarin gel for when you got angular cheilitis, you know, those little cracks.
Yeah.
But we can't seem to access that anymore.
Yeah.
So cooling gels, sometimes a little bit of ice and water is quite nice.
Chewing gum as well, I've heard, can sometimes.
The flavourless ones, because the minty one stings like hell.
Yeah.
It burns. Or even the fruity ones, but always sugar-free.
Yeah. Okay.
Because stimulating, like if you have 2 pieces of chewing gum for 20 minutes, will stimulate your saliva and create a really nice buffering effect.
Okay.
But it does take 20 minutes of chewing a piece of chewing gum, which is tough.
So reduced saliva production causes dry mouth, which causes poor hygiene, because your saliva is actually keeping your mouth healthy. So explain that.
Yeah, so your saliva is like your buffer. Your mouth is moist. So it needs that wetness. If it's not there, certain of the bad bacteria will grow, and they'll grow faster. Your saliva flow will buffer your teeth and reduce your decay. It'll also keep your bad bacteria somewhat at bay. So if you lose that saliva, your mouth gets dry and sticky, and you'll get decay faster, and plaque will grow faster also.
So how can perimenopausal, menopausal women stay on top of their oral hygiene?
Yeah, so get the right tools. So if you find your mouth is sore or you've got burning mouth, an extra soft toothbrush is what I would recommend.
Okay.
Because it's much easier on your tissues. You can get flavourless toothpaste if you find the minty ones are quite strong and irritate that burning sensation. So I'd go with them. And a fluoride mouthwash that's alcohol free, and use that after a meal, because then you can buffer the food out of your mouth and reduce that acid attack. So they would be my and your interdental cleaning, obviously your flossing or your little brushes. But then supplements as well. You can things like the Biotin, the Bio Extra, oral gels to just make your mouth feel moist, and sipping tap water.
A mouth coat is a nice spray.
That's the one.
Used.
Yeah, that's a lovely one.
I remember a couple of my older ladies used to use that all the time in the pharmacy. So yeah, and that's a nice one.
It's a lovely one. And anybody who's got like a little denture or anything like that, take that out at night. Always remove that at night and give it a brush just with warm water and a toothbrush, and leave it out so that your palate gets a bit of a break and your gum gets a bit of a break as well.
But do your teeth not keep your face kind of the shape that it's in? So when you lose teeth, you
can get a bit something in. Yeah. So you lose if you lose a tooth, you can get drifting of other teeth. They can come out of position. And that comes down to that bone I was talking about earlier that holds your tooth in place. That shrinks right up. So your face can shrink in. Your speech can be affected then as well. So it's really important that we maintain the health of your teeth. So I always think if people are nervous or worried, we've seen it all. You are never going to be the worst person that's walked into the surgery.
You're never the dirtiest mouth that's gone in there. And it doesn't matter even if you are, you won't be judged. You love an old dirty gob, don't you?
You're the best because you're going to get great results.
Yes, exactly. I got prescribed a mouth guard there recently.
Who doesn't need a mouth guard nowadays, I think.
I haven't been using it, and my hygienist told me, have you been using your mouth guard? Because she says the gums are receding a little bit, because obviously I'm using it because I'm grind my teeth at night time.
Yes.
I didn't even know that. Obviously I've
unconscious behaviour.
Yeah, loads on my mind probably, and just doing it at night time. So I did get prescribed a mouth guard, but Jesus, it's not the sexiest thing to wear in bed. Not that I want to be sexy in bed, but it's just, the putting it in.
The best.
But I can sleep with it, but it's also having that thing that you take out of your mouth. I don't know, it just doesn't feel right. But I'm going to start using it. But what do mouth guards do?
Yes.
Night guards do for people?
So like you said, if you're clenching or grinding habits, you can lose tooth surface, you can lose gum, and you can get jaw pain. So what your night guard will do is it will correct that behaviour. So instead of you damaging your teeth, I assume you only have it on the top?
Yeah.
Yeah, so it clips in.
Yeah.
And when you start to grind, it sort of locks things back in place. So it'll keep everything where it's supposed to be.
Okay.
So you're not going to cause damage to your tooth. So you can get your teeth can get really flat. They can get shorter. You're going to be looking at people now going, oh, their teeth look really tiny. Yeah, they're really square. If they look like that, they're probably clenching or grinding. Okay. Whether at night or through drug habits or just like a nervous tick. It's really, night guards are vital.
Okay.
You can end up with, I didn't wear my night guard and I got a root canal last year.
Okay, right. You've scared me now.
Wear it.
I have to go and look for it.
Yeah.
And are night guards expensive in general to get fitted for? Because you need to mould to your own teeth, don't you? Or can you just buy can you just buy one like off the shelf?
No, like you can go and get, like the kids wear the sports guards. No, it's a different material. It's much, much harder. So it's a really hard acrylic and it will just keep everything in place. If you have, some people wear like the retainers that they've had from orthodontics, or they will get the sports guards, you'll just grind right through that.
Okay.
Yeah. Where these have, if you have a look, a lot of them will have little notches on the bottom to match your bottom teeth. So when you clench in, you're locked in place.
Okay.
Yeah.
Okay.
Stops your mouth breathing sometimes too.
What's wrong with mouth breathing? I hear all this all the time.
Yeah, mouth breathing, it's not natural. Like it's like in through your nose, out through your nose is how your mechanism works. But sometimes if we start to breathe through our mouth, it can misalign your jaw. You get dry mouth, so therefore you're going to have increased risk of decay, more plaque, which can increase your risk of gum disease. You change your saliva, your bacteria in your mouth can change, and the function of your mouth becomes a little bit tougher.
So how do you know if you're a mouth breather or not?
sometimes you can look and you can see really clearly, like you can have a patient come in, their hygiene is perfect. I always disclose your teeth so you can see exactly what's there. And they've no bacteria anywhere. They're doing really well. But then you've got this red line of gingivitis kind of from your canine to your canine. It's because they're breathing through their mouth.
Okay.
So I said that to a lady, I think it was earlier this year, and she's like, oh, I didn't know you're supposed to breathe through your nose. She says, I always breathe in and out through my mouth. So the next time she came in, she said she'd been wearing mouth tape. She went to her doctor. She got like a nose tape for here. And now she breathes through her nose. No more gingivitis for her.
So do you consciously or or unconsciously breathe through your mouth then?
Yeah, it's usually unconscious. Unless somebody has had, like if someone has a broken nose and they know that there's a slight blockage, they can consciously breathe through their mouth. But my youngest breathes through her mouth at night.
Okay.
So we need to get her to an orthodontist.
And is mouth taping a good idea?
In adults, I would say yes. I don't know about kids.
Okay.
I wouldn't be risking that.
Yeah.
But certainly, like you can, my husband with mouth tape now.
Okay.
He used to have difficulty sleeping and he uses mouth tape and that has made a big difference for him. So don't worry about going to bed with a night guard.
With night guard. So I go to bed, night guard, bonnet on my head, eye mask.
Yeah, he'll have his mouth tape on.
It is hot in the bedroom.
I'm telling you, we're sexy beasts.
I know. Jesus.
It's crazy.
So
that's all after you've taken your makeup off.
Oh my God, I know. What about brushing your tongue? Is that important?
Really important. I like a metal tongue scraper.
Oh.
So they're nicer and you can actually clean them in the dishwasher. Like I'd put them in on their own. I know that's not very environmentally friendly, but I couldn't be sticking a tongue scraper into the dishwasher with all the dishes. But once a month or so I'd stick it in. Now, it is not pretty. It is talking about being sexy. It is not sexy, and it can feel disgusting.
Every night, or
I would probably do every second night. Recommended it's every day. But say you are a heavy coffee drinker. If you're a smoker, I would really recommend that you use a tongue scraper because you get this build up on your tongue surface. So if there's any changes that we'd naturally look for, we can't see them. So there could be something nasty brewing under there and you'd miss it. But if you use a tongue scraper...
What kind of a layer do you get put on?
You get this like brown coating or a white coating on your tongue. Yeah, but it can happen. Think about people that are on long-term antibiotics.
Yeah.
And then their mouth gets a bit drier. The bacteria has changed. You can get thrush. So, things like that, a tongue scraper can be really good for. So some people use them short-term. Some people use them all the time.
Can you not just use your toothbrush?
No, I wouldn't. I can see that now. I'm a bit grossed out by that. A lot of people do, but if you're using your toothbrush, you want to clean your gums, you want to get in around your tooth surface, it's different bacteria on your tongue and you can cross transfer. And it's just, your tongue is where like your smelly bacteria might be, say, that will cause bad breath. So,
no one's going to be French kissing after this.
I tell you, between the toothbrushing, the mouth taping, the night guard.
I know, there's nothing going on.
It's all bad, folks.
Can I actually ask you, the interdental brushes, because they always I use them and I like them.
Yeah.
But how long can you use one for? And obviously you need to rinse it out after using it like you would a toothbrush.
Yeah.
But it seems to me that they're dirtier than toothbrushes because you're going in between your teeth and they always come out with a little chunk of something on them.
Yeah.
So what is the general recommendation for them?
I'd say 3 to 7 days. So if you say come in and you've got loads of inflammation and you've loads of bleeding in your gums, I'd say maximum kind of 3 days. But like that, give them a good rinse under the tap. Otherwise, treat it a bit like a micro toothbrush. Once the bristles on it start to bend or get a bit frayed, you need to get a new one out of the pack.
Okay.
Yeah.
And should you leave them to soak in a mouthwash and that to keep them clean, or?
There's no evidence to say.
Okay.
So I just rinse on the cold water and just give it a clean. But
they're not very environmentally friendly though, are they?
They're not. But it depends on different brands. So there's a brand from Sweden that they use a carbon...
TP.
Yeah, so they use a carbon neutral factory. So sometimes that makes me feel a bit better. But also what you can do is if you take the handle of your TP brush and get a tweezers and you pull the bristles out, that's on a little metal wire, you can recycle the handle. Just pop it into your general recycling bin.
Oh.
So that makes me feel better about using them. Yeah, they're less wasteful. And the same with your toothbrush. If you're using like a manual toothbrush that just has a plain plastic handle, if you put that in the fridge in a bag for like say 72 hours, you can then snap the head off that, and then you can recycle the handle.
So the TP brushes, right? And I know I'm saying TP,
Yeah.
but there's different brands. But actually, I have to be honest with you, I tried the knockoff brands and they weren't great.
They don't work. And it's
shite, bent and everything like that. So I just use the TP.
The TP is known to have the best steel in the little bristles, so they don't bend as much. And a great tip for them is they're easy. If you think you're going through that little space always, your spaces as you go further back, they don't face forward, they face the side. So just put a little like a curve, like a banana shape into your TP, and it'll automatically just kind of pop into your space.
The bristles bend a bit more?
Yeah. I love the easy picks as well.
Do you? Okay.
Yeah. And again, they'll say single use on them. Absolute crap.
No way.
No. They're like, you can't be, I know it comes from a carbon neutral factory, wonderful. However, there's nothing wrong with that. If it comes out looking the way it went in, keep using that for 3 to 5 days.
I do until the white underneath starts to show.
Yeah.
I hate waste.
So do I. And they're also, things are expensive. Especially now, everything is so expensive. So I think a pack of them is anywhere between €6 and €7.
Yeah.
I think you get about 36.
Yeah.
They should last you months.
I love they have a little handy travel thingy.
Yeah, the little case with it.
In my bag. Because actually just to
You're an ideal patient.
Just to pick stuff out of my teeth though. No, stuff gets stuck in my teeth all the time.
Yeah.
I do be smiling at people.
Yeah.
And I know they're looking at me because a bit of lettuce stuck in between my teeth. So I just use them to discreetly pick stuff out of my teeth regularly.
And it's funny, one of my sister-in-laws, we were out for dinner and she was using them and she's like, I can't be without these now that you showed me them.
I do like them. I do love them.
And they're so easy to access. And they're and she's like, you can be very discreet with them.
Yeah, you can.
They're great.
Actually, now that you said easy to access, I'm just wondering, people with dexterity issues must find it difficult to look after their teeth.
This is something that I don't think patients even know we do this, but I come to greet you in the waiting room and I'm going to bring you up. We're assessing you already. So I'm looking at you and I'm like, okay, she got hearing. Say, for example, you've got hearing aids. So you automatically say, I have to adjust how I'm going to speak to this person. If they have a walking stick, you can see arthritis in their hands or all sorts of things. So before you've even sat in the chair and I've asked you about your medical history, we're forming a treatment of how we're going to best be able to help you at home.
Yeah.
So if somebody has dexterity issues, particularly arthritis in the hands, it's really tricky. Best thing I have found is Play-Doh. So if you have somebody with an electric, if they can hold an electric toothbrush, fantastic. They're a little bit heavier than a manual. But if not, if you have a manual toothbrush, get a big blob of Play-Doh around that, grip it, and then you've made a natural homemade grip for your toothbrush. So it's easier to, first of all, get that brush into your mouth. Now, using it effectively, that has its other challenges. So we just have to show you to do the best you can at home. You know?
That is going in the reel.
Yeah.
Because I'd say people never think of that and it's just so easy.
And it's so cheap.
But if they had an electric toothbrush and they use that Play-Doh, technically they could just run the electric toothbrush around their mouth and not have to do too much scrubbing then.
Exactly. And if you are getting something in there, you're going to have a benefit. So if you have dexterity issues, but you have that, like you say, your electric brush, if you can hold it is even better. They're a bit thicker, so your grip tends to be easier. And then you add the Play-Doh is better again. If you're getting in at all, you're going to have a benefit.
Yeah.
You know, I think you've got to always understand that patients have lives. And there's very few patients that come in with perfect health. Sure, I saw Ashton and I was like, don't judge me.
I know, yeah. Oh no, I'm always embarrassed. I feel I'm going in for like an assessment with a teacher or something like that. I'm going to be given out to.
I do say it's like going to confession, isn't it?
Yeah, I know.
People come in like, now I've been brushing but I haven't been using my TPs.
But should it be sore getting your teeth cleaned? Because I remember, I mean, I did have a couple of experiences where they literally felt like they were going in under my gums, like. And it was
like a jackhammer.
Yeah, it was torture. Yeah. But then I've been to the likes of Ashton and it's lovely and gentle. So how?
It can be equipment, it can be training and how you do it.
Okay.
So I use a system that's pain-free.
Okay.
But it doesn't mean that every time you come in you won't feel something.
Yeah.
But it shouldn't be that you're so tense in the chair and your toes are curling and you want to jump up and out. But a lot of it can be your training and how you use the equipment. It can be the time. Sometimes people come in and we don't have enough time and they don't always want to come back for a second visit. So you're trying to do your best.
Okay.
But really, it should be minimally invasive. It should be that if we explain it to you properly from the beginning, say, okay, Laura, you're actually going to need 2 visits. And if you're okay with that, it's more comfortable initially. If you have tartar or plaque under your gums, it's almost like you're trying to pick a scab that's not ready to come, but we have to get rid of it, because if we don't, that continues to fester and you get a chronic inflammation with that nasty bacteria that can travel all over your body.
Okay.
So for maybe like 30 minutes of discomfort, you're going to be okay.
Okay. And then the ideal amount of times you go and visit a hygienist a year?
I would say at least 4 times.
4?
Yeah, like
Wow.
if you have any inflammation, I want to see you again. Okay, we'll take you. So you've generally got good health. If you come in and you don't have bleeding and you've got a really low plaque score of under sort of 20%, I'd be okay to see you in 6 months because you're healthy. If you're consistently presenting as that. If you come in and you've got gingivitis, you've got bleeding of more than kind of 10%, if you've got more than 20% plaque, you need to be seen more often until you get healthy. And I love the mouth in the sense that I'll do the treatment and I've sent you off now and your teeth are nice and clean. But remember, in an hour, plaque is starting to form. But if you care for it at home, you can get that healthy and keep it healthy, and then you need us less.
Okay.
So the more you do as a patient, if you've got like generally good health, the less you need us. If you've obviously got other factors such as gum disease, you need to always be seen more than twice a year.
Okay.
Yeah.
And then at what stage, what age should we start bringing our children to hygienists?
So in Ireland, you have to see the dentist before you can see a hygienist. It's a bit of a bugbear, but that's the legislation. So I would say bring your child to see the dentist before their 2nd birthday. Even if you're coming in, I always say to women or men, bring the kids in with you so they can see what this is about and they're not scared. Play dentist at home, get them used to things like the taste of the gloves, a light shining in their eyes, even just lying back can be freaking out for them, you know?
Yeah.
But before they're 2.
Okay.
Yeah. Or if you look in their mouth and there's something that you're not happy with, come in.
Okay.
Yeah. And most general dentists will have a look at children.
Okay.
You know? We want to see them.
Can you keep your mouth clean enough that you wouldn't need a hygienist?
Yeah. Like if you, I have 2 patients that come in to me once a year and they come in because they want things to be checked. So they've been just really good oral hygiene. Like they work so hard at it. Like these 2 people, they're husband and wife. I think they're slightly competitive with each other as well when they're getting their plaque scores. And I'm like, yeah, you're 5%, but no more. It was 3%, you know, and they go home and they're raging. But they're immaculate. And there's a lot of factors to that. Obviously, they're very committed, and they're generally committed to their health as a whole.
Okay.
They don't have any underlying medical conditions. They're not on any medications. They're in their late 60s and they're retired and they have time and freedom
to clean their teeth. Aren't they lucky?
That's what they're doing.
Exactly. My goodness.
So, yeah, there are times, but you will always have to have a checkup because a dentist will be looking for other things other than plaque.
Okay. Are there any other diseases that occur more when someone's dental hygiene isn't good?
The diabetes is a big link, cardiovascular disease. So if somebody has, say, for example, heart surgery, they have to be with a valve replacement, they'll have to have an antibiotic before they have a hygiene appointment.
Okay.
Or anything that's going kind of under your gums to clean. If you are pregnant, you've got to be careful as well. If you've got gum disease, in an ideal world, it would be lovely if you're planning a pregnancy. Sure, that doesn't always happen. Very rarely, I'd imagine. But to have a dental checkup and a hygiene before you become pregnant. If you're pregnant now, I'd say go and see your hygienist if you haven't already, because it's safe, first of all. But if you have untreated gum disease, you're at increased risk of preterm birth and a low birth weight. So, bacteria, again, it travels down, and because you've such an increase in blood supply, your estrogen and progesterone are higher, you're immunocompromised, bacteria can cross over through the vessels into the placenta and then feed into the baby. So you've got to just have good hygiene.
Okay.
Yeah. Now, there's also a link with preeclampsia, but I have preeclampsia and I don't have gum disease, but it's just keeping everything healthy. It's all about minimizing risk, keeping everything as healthy as possible.
Does our oral hygiene or health change during pregnancy? I know my mum said she lost a tooth for every child she had. Does that actually happen?
No, usually that's such an old wives' tale, and I love hearing that, and I love when patients say that because it's a great opening for a conversation with them. You can get this really common condition called pregnancy gingivitis, and again, you've got such a massive spike in hormones and blood supply that you're and you're immunocompromised again. So bacteria in your mouth can take advantage of that. So your gums can bleed a little bit more. So it's just looking after them. But again, if you've got gum disease, that can become exacerbated if it's not looked after. So if you become pregnant and you've got like really severe gum disease, it's really messy up around there, you've loads of plaque, loads of bleeding, the risk of that tooth is greater. So it's just getting everything healthy. So yeah, losing a tooth on every pregnancy, or, the baby sucks all my calcium. So they're not actually true, but it's a great way to have a conversation with a patient to explain how we are in control of that somewhat.
People that are on cancer treatment, how can they look after their mouths? Because obviously, they can get it's awful pain as well with the treatment that they're under, depending on what treatment it is. I remember making up the BMX solution for many people.
Oh yeah, that was wonderful stuff to help, but it's terrible that you have to use it. I worked in the head and neck clinic now many years ago in the dental hospitals where patients had cancers. So anywhere in the mouth or the jaw in particular, but anybody undergoing any sort of chemotherapy, unfortunately, we can't, as a dental hygienist, we can't treat anything that's going to go under your gum, because that bacteria can travel and cause really severe infections, make you very ill. So the best way that you can mind your teeth is use an extra soft toothbrush, just gently clean around your gums. If you get a little bit of bleeding, it's okay. It just means there's some inflammation there. Just keep brushing.
Okay.
You can get really dry mouth and awful ulcers, and those poor patients can have a terrible time. So again, you can get, like the sponges, and just soak that in water and just try and keep coating your mouth. The mouth coat, Kin do a really wonderful gel called Kin Care.
Yeah.
You've probably seen that in the pharmacy.
Yeah.
That's great for mouth ulcers as well.
Okay.
Because it can be really uncomfortable. Keep the lips moisturised, and with an SPF as well, not just like a regular one if you can. It just keeps everything moist. That's the key thing, is keep your mouth moist to try and prevent decay, prevent worsening of gum health and mouth ulcers.
Okay.
Yeah. And mouthwash as well, like an alcohol-free mouthwash like Kin Care, Pronamel, Colgate do one called Florigard, Oral-B have one. Once there's no alcohol in it, because it's not going to sting or dry.
So I was just going to ask that. Why did you say alcohol-free a lot?
Yeah, because if you think your mouth, again, it's moist, alcohol can dry your mouth. So even for those few moments where it's dry and it feels a bit more astringent, that's not a good feeling. You need your mouth to be moist to keep that bacteria in an equal state.
Okay, and what does a mouthwash do?
Some do nothing. Some will really help. So depends on the ingredient and what you're using it for. I tend not to recommend mouthwash a whole lot. If someone is coming in and it's got a lot of inflammation, I might recommend a mouthwash that has an ingredient called chlorhexidine for 2 weeks and 2 weeks only, because that's enough to help with what you're doing at home to keep that bacteria away. So it can be anti-inflammatory and antibacterial. But
it can also cause a little bit of teeth staining, so you need to make sure that you brush your teeth as well.
Really well. Yeah. And if you use certain mouthwashes, like you could have a patient come in and you'd be like, what's happened here? And you're going through it all. They don't use any tobacco. They're not a caffeine drinker. And then they're saying everything and you're kind of chatting away. If they change products, I use a mouthwash now. And they've been using that for 3 months. And their teeth are like brown. They're like the colour of, like when those old doors.
Oh yeah.
You can get rid of it.
That's the chlorhexidine mouthwash you're talking about. Okay.
So 2 weeks only for that particular one. Yeah.
And then other mouthwashes, because you said some of them do nothing. Like sometimes is it just to freshen the mouth?
Yes.
Like, and what's the best time to use it? Because I saw someone saying actually the best time to use a mouthwash isn't after you've brushed your teeth, it's before you brush your teeth. Is that?
Well, I tend to say if you can get in with your interdental brush your teeth, spit your toothpaste out and leave that residue of your toothpaste in there. It's kind of working on your tooth continuously for a certain period of time. If you want to use a mouthwash then, after your lunch, after a meal, because you're having an acid attack. So every time you eat, you'll get an acid attack in your teeth. So the pH of your saliva will drop and it's coating your teeth in more of an acidic environment.
Okay.
If you go in with an alcohol-free mouthwash, you can sort of counteract that acid attack somewhat. And it's a good way to buffer, get the food disrupted from in between your teeth and clean your mouth a little bit better.
So that was it. If you wash your mouth with a mouthwash after brushing your teeth, you're actually negating the benefit of the toothpaste being in contact with your teeth post-brushing. Is that right?
Yes. Yeah. No,
that was a fucking mouthful now.
You did very well.
I said that better. I'm trying to wrap my head around all this. Mouth now, it's not my forte.
Yeah, it's kind of it. Yeah, your trifecta is your toothbrushing, your interdental cleaning and your toothpaste.
Okay.
Then you can add tongue scraping and a mouthwash at a different time.
Okay.
So, yeah.
Okay, grand. And alcohol free generally?
Yes, because you don't want anything drying your mouth is not good.
Okay.
So,
So why do they put alcohol in them then?
I don't know.
Okay.
Yeah, I don't know. It's not an ingredient I would ever, when I look for patients to have mouthwashes, there's very few now that do, but some still do.
Okay.
So you just have to be, if you want to use a mouthwash, just read the label. And if you see alcohol, no.
And are there any more risk factors for gum disease, like what we were talking about, or gingivitis?
So you've got genetic factors. So sometimes you are just predisposed to certain, like anything in the body, you can be just predisposed to certain conditions. If you smoke or use nicotine products, you can increase your risk of gum disease. Because again, if you smoke, you know this, like your blood vessels don't dilate the way they should. Your delivery of the blood to the mouth isn't as good. So therefore, you're not getting all that oxygen and the good nutrition into the tissues. So you can get gum disease.
Does vaping have the same effect as smoking in that respect?
Vaping, there's still a huge amount of research, but vaping is seen to be a step down from smoking. But you can get lots of changes in the palate, the way it's inhaled and pulled in. You can still get the vasoconstriction because you've got the nicotine in the product.
Okay.
And the same with the snuff or the snus pouches. They're a massive risk for oral cancers because, you know, have you seen them? Like they're really popular with
my
the
kids
kind of
talk about them.
Yeah, and they stick them up here in the little pouch there, and they can leave them there for hours. Sometimes they swap sides with them.
Yeah.
And you start to see the tissue up there should be nice and pink or red. And it becomes white. So it's starting to change. It's like it's toughening. So you need to be really careful. So,
and that they're a risk factor for oral cancer, that's not
oral cancer.
And is that because they're nicotine or what is it?
It's the nicotine in it, and because they're constantly just leaving it sitting in the same space.
And it's causing the vasoconstriction, which is reducing the blood flow and causing all kinds of things too.
And like in severe cases you can see where there's like a burn through the mouth up, and you can cut into the sinus area, and that it's nasty.
What we do as humans to ourselves.
Yeah, like it was great here in Ireland because we did actually really well with stopping the teenagers from smoking, and then it seems to have shifted to college students.
Allowing those vapes is just crazy with the names they have and the gorgeous flavors and the flavors.
Yes.
Really, that's for
attractive.
kids. It's attractive for children. It's a disgrace.
I think there's a massive case that was successful in the States against the tobacco companies for those colourful vapes and flavoured vapes, because they said they specifically were aimed with the intelligence at getting kids hooked. It's awful.
Oh, it's crazy. I'm sure if they got you, I'm sure if they did a discovery on the marketing and the email and the talks and stuff,
it's in there somewhere, isn't it?
100%.
That's a whole new program coming out on Netflix sometime.
So tell me about more risk factors, just so people understand what they have.
So really, risk factors would be smoking, drug use, excessive alcohol. You know, you're looking at your normal alcohol intake, you're fine. But if you're somebody that drinks a huge amount of alcohol, like above what the normal daily recommendation would be, your mouth again can get drier. You can grind more, you can eat foods that aren't so good for you, and you increase decay and gum disease. So also if you've got diabetes, if you've got rheumatoid arthritis, and then pregnancy because of the change in the hormones.
What does the rheumatoid arthritis do? Is it the gum disease causes the rheumatoid arthritis, or the rheumatoid arthritis causes the gum disease?
They're just bidirectional. So if you have them both, there's another bacteria called F nucleatum, if I think what the F stands for.
Don't worry about it, no one cares.
So what happens with that is that travels down and releases all these nasty inflammatory markers. And so if you have arthritis, that becomes worse.
Okay.
But that's actually, if you treat the gum disease, brilliant, you'll get a reduction in your arthritis. But actually, if you have that bacteria, green tea is a wonderful antioxidant for that. So a cup of green tea a day if you've got gum disease, and it's going to help you to no end.
Brilliant.
Yeah, simple little thing. And don't worry, the stains, we can remove them.
Yeah, well, I have L-theanine from green tea in my R&R relax, so people don't
there you go.
the green tea.
If you don't like green tea, get an R&R.
Exactly. So, anything else?
I suppose really, like, in dentistry, I think there's like this, people have a perception that it's always about pain and it's about treatment. But I really think that there's no mouth that, like the longest I ever saw a patient that hadn't been to a dental surgery, he went in 1981 and I saw him then in 2010.
Okay.
And we managed to keep all of his teeth.
Okay.
You know, so never be afraid. Like, and I say, like, you couldn't see individual teeth in there. There was so much tartar.
Oh my God.
It was heaven for me. So the dirtier the better in some ways. And then we get you healthy. So
Okay.
But just brush twice a day with your soft toothbrush, or I prefer an electric toothbrush. Use a TP. And what you want to do is measure your size. So buy a multi-pack if you haven't been to your hygienist. See what one feels the most comfortable going through. You want to touch the teeth on both sides and your gum. And then use a tongue scraper if you want once a day. And just have a good diet. And don't smoke. Don't take drugs.
Okay.
You'd be flying it.
And when you say a good diet, do you mean reduce sugar as well? Or
Yeah, it's so difficult now though. Like you go into
because
the
like years
supermarket.
ago they didn't need all this. Like in the Stone Age,
Yeah.
I think they had great old teeth because there's no sugar consumption.
Was,
Is
do you
that
know
it?
what? Yeah, they did a study on a caveman diet. They put these people on a caveman diet. And what they found was they didn't really get decay. The gum disease and everything was better. The bacteria changed. So you still got plaque, but it wasn't the nasty, nasty stuff that we would get now. So the caveman diet may be the way to go, but still brush your teeth and your gums. But yeah, if you go into the supermarket now, you have about 80% of what's in there has sugar in it. Like it's nearly impossible not to have sugar in your diet.
Yeah.
But it's just being careful about how you eat your sugar. So if you're going to have a cup of tea, don't put sugar in it because you've got a hot drink and then that sugar becomes even more aggressive. So you're going to increase your risk of decay. So try...
It becomes more aggressive because it's a hot drink.
Yeah.
Why?
Yeah. The sugar becomes more aggressive because you've melted it down. So it'll stick to your teeth more. It'll get in there. You've dissolved it. So it's more aggressive on the tooth surface. So just have a cup of tea or a cup of green tea or an or. And then you can have, the more sugar you have, it makes your saliva more acidic. So you're in a constant state of attack. So your tooth is your hardest substance. So if you think of it like that, if you constantly are putting acid onto your tooth surface, it's going to break that down and it doesn't regrow. So we really need to mind it. You can get fillings, but why get a filling when you can prevent it? I think it's like 32% of the Irish population over the age of 5 have decay. So if we can not put so much sugar in, you can keep those teeth healthy from birth to death.
You were saying a lot of people think that there's a barrier to access care for, say, autistic people or maybe Down syndrome people.
Yeah.
But you say that there isn't, as in there may be a barrier in terms of access financially, but you look after everyone and that people should never be afraid to pick up the phone and go. Is that right?
Absolutely. And you will find most general practices will always want to see patients with additional needs because they're often the people that need most help.
Yeah.
So like first and foremost, that's what we're here for, to help you. It can be that we can turn all the lights down. We can give certain people don't like the light, that can be a trigger. So you've got darker glasses. We can turn off music, make the place quieter. And if a dentist sees a patient or a hygienist sees a patient and we say, do you know, this is beyond error, we can refer you on.
Okay.
Because there are dentists out there that will help. But generally, if you want to see a dentist, don't be put off. Make the call.
Okay.
Yeah.
I am going to do quick fire questions. Okay. What's the biggest mistake people make when brushing?
Not brushing their gums.
Manual or electric toothbrush?
Electric.
How long should you brush for?
2 minutes twice a day.
Hard or soft bristles? You answered this already.
Soft. Yeah.
Is brushing harder better or does it damage gums?
It will damage your gums. Slow and steady.
Morning or night brushing, which matters most?
Night.
Do you floss before or after brushing?
Before.
Is water flossing as good as a string floss?
No. If you use a water flosser, you still have to use either a TP or floss as well. It's not enough on its own.
What do flossers do then? What's the hype about them?
They're great if you have an implant. So an implant is like a little screw, a titanium screw usually into your bone.
Right.
And then you get like a false tooth on top.
Yeah.
And there's always a little bit of space under that. So a water flosser can be great for cleaning around your implant.
Okay.
If you have an implant, you have to look after it. It's not, I've had an implant, I don't need to do anything. It will still get plaque on it. So water flossers can be great for access there. Or if you've got a tricky little bridge to clean, things like that, around braces.
Around braces and stuff like that.
Yeah, they can be really helpful.
Okay. Can stress affect gum health?
Absolutely, yeah.
How do you stop gum recession from getting worse?
If it's genetic, not a whole lot you can do, but if you've got bad habits like overbrushing, using a hard toothbrush, scrubbing too much, clenching, grinding, go and see your dentist and get it all looked at.
Okay. Is bad breath always a sign of gum problems?
No. It can be just that you have a particular type of bacteria that causes smelly breath. So it can be on your tongue. It doesn't have to be around your gums. But if you have bad breath, come and see us.
Okay.
Yeah, it's usually very easy to fix.
Can tartar be removed at home?
No. It's like concrete on your teeth.
What causes staining most? Tea, coffee or red wine?
Ooh, I would say coffee. But I love coffee, so just enjoy it.
How do you keep teeth whiter without sensitivity?
Good brushing. Keep the plaque away because plaque is creamy and yellow. So,
whitening toothbrushes, do you recommend them?
Oh, the whitening toothpaste?
Toothpaste, sorry.
Generally, no. They can be more abrasive. So long term, you're more likely to pick up stains.
What is the safest whitening option?
The dentist, and get the bleaching trays and your gels from the dentist.
So you shouldn't get the Crest from America that is like
do you know
65,000% of the stuff that you don't have, and stick it in your mouth and have sensitive teeth for a week like I did.
Occasionally they are fine.
Okay.
But what you get from the dentist is the active ingredient is suspended in a gel, and that gel is much gentler and it releases it slowly and more effectively, so you'll get a much more even distribution where you shouldn't really have sensitivity, but if you do, you can manage it. But the strips can be overused because they do have a good result quite quickly, but then they can be very sensitive, and long-term use of them wouldn't be advised.
Okay. And those super duper strong ones you can really only get in the States. You can't get them here in Ireland.
No, because in the EU we legislate much more aggressively on the active ingredient.
Which is a good thing.
Really it is.
Why do teeth get sensitive?
Lots of reasons. You can have breakdown of your enamel. You can expose your root surface. So if you've got recession, you don't have enamel on the root of your tooth. So they can be more sensitive. Clenching, grinding. So your little ligament around your tooth can be like throbbing. Gum disease. Lots of reasons.
Best products for sensitivity?
Oh, so again, a soft toothbrush. Use lukewarm water when you're brushing your teeth so that you're not getting that shock of the cold. And then a sensitive base toothpaste. So oral
like Sensodyne?
Sensodyne, yeah.
What is the ingredient in them that works?
One of them is stannous fluoride, which is a different type of fluoride, so it binds to your teeth a little bit better.
Okay.
Yeah. They're calming and they kind of seal your tubules in your tooth.
Okay. Oh, the tubules. I remember learning that.
Yeah.
Jesus. It's all coming back now. Can enamel grow back?
No. But there is an ingredient that I love in some toothpaste called hydroxyapatite, and that can help remineralize your tooth. But it still won't grow your enamel back, but it can help in terms of sensitivity.
Okay. Sparkling or flat water?
Flat.
Why?
We used to think sparkling water was okay, but it can be acidic and cause damage to your tooth surface. Occasionally, if you're going to have it with the meal, fine.
Should you brush your teeth straight after eating?
No. Again, you're having an acid attack, so that's a chemical process. Think of all those acids flushing around. Then you go in with your toothbrush and you're pushing those acids in. So no, wait 30 to 60 minutes.
What's the worst snack for teeth?
Oh, I would say any dry, sticky things like raisins, caramels.
Really?
Yeah.
Raisins?
So they're like a little sugar pellet. So I think they have potassium in them, which is quite good for your body. So if you're going to have them in your porridge, say.
Yeah.
And it's your meal. But, kids in the lunch boxes.
Yeah.
And it's really hard being a parent again because you think you're doing something good.
used to give us them all the time. Sun-made raisins instead of chocolate because she was like mad into the healthy eating.
Yeah. And they stick. So like caramels,
yeah.
They will stick to your teeth and the sugar is released over a longer period of time.
Hey, there you go. Jesus, every day's a school day.
I tell you now.
What is a tooth-friendly snack that people don't expect?
Ooh, a banana? I don't know if that. Let me think about that.
Popcorn? No, popcorn?
Popcorn is fine, and I love popcorn. We're massive popcorn eaters in our house, but I hate when the little husk gets caught under your gum. That can be a nightmare.
Oh, it's so annoying.
Particularly if you have a wisdom tooth and you're trying to get it out. It's tough. Yeah.
Okay. Chewing gum, good or bad?
Sugar-free, good.
Okay.
Yeah, 2 minutes, 20 minutes. 2 pieces, 20 minutes.
How bad are energy drinks for the teeth?
Oh, God. Even the ones that have sugar, absolute catastrophe. Without sugar, an absolute nightmare because they're going to cause acid erosion. So you mightn't...
Without sugar, they cause acid erosion?
Yeah, because they're so acidic. The fizzy ones.
Oh, the fizzy ones. Okay.
Yeah.
Okay. Do smoothies count as sugar for teeth?
They do. Now, I draw the line a little in the sense of use a straw,
Okay.
and drink it quickly.
Okay. Lemon water in the morning, dental disaster?
Again, just drink. I like lemon water. So it can be erosive, but it's really good for you. So if you're having a small glass, drink it quickly and drink water straight after.
Okay.
Swish it around your mouth to cleanse.
Is charcoal toothpaste a good idea?
No scientific benefit. It just makes your bathroom harder to clean.
Are natural toothpastes as effective as fluoride toothpastes?
No.
Are sugar-free drinks safe for teeth?
Again, anything other than water is going to have an impact. So if you're having the likes of, say, like a blackcurrant or a cordial or anything like that, there will be an impact. So again, you have to have it with a meal, but don't be sipping on it all day.
What's the most common thing that you wish people knew?
To use a soft toothbrush and brush your gums gently.
What's the one thing that would improve most people's oral health overnight?
Oh, overnight. To clean in between.
Okay.
Yeah, 40% of what you need to clean is in between your teeth. So that's like missing
We
this.
got through 45 quick fire questions there.
There's not that many, was there?
Yeah, it was great. Okay, so I have 2 questions that I ask every guest.
Okay.
Were you told this?
No.
What advice did you give young people today?
A bit of advice for young people. Oh, don't worry. What you're doing right now is good. Don't sweat it. Don't stress it. All those little things will be fine. And the big things, just they'll come and they'll go. Don't worry about it.
And what's the meaning of life?
Happiness. Yeah, I think just find something that you like and just every day wake up and just think, isn't today going to be a good day? Because I think you can dictate your path in life with that attitude. That if you feel it's going to be miserable, Jesus, it will be. But just wake up and smile. You just feel better straight away. Yeah.
Eimear, this has been a lovely little podcast. I've learned loads.
Loads of homework. So when you see Aisling again, I'm going to tell her to disclose your teeth and you'll have a 0% plaque score.
Okay, brilliant. I understand the assignment and I'll do that, and I'll let her video it if she'll be in it with me.
Yeah.
Okay, brilliant. Thanks a million.
Oh, thank you so much for having me, Laura.
Glow from the inside out. With my Fabu Skin, Hair and Nails Glow, which blends 12 active ingredients including reishi mushroom, amino acids, vitamins and minerals to support collagen production and skin, hair and nail health on a cellular level. See the amazing before and after pictures of fuller, thicker hair, radiant glowing skin and longer, stronger nails on fabulwellness.com. Available on fabulwellness.com and in pharmacies and health food stores nationwide.